Your skin instructor's tip of the week. Start elevating your skin analysis by making it more intentional. After you cleanse your client's skin, before you move into the rest of the service, take a dedicated moment to truly assess what you're seeing. This is when the skin is clean, makeup free, and you have the clearest view. Scan the scalp, hairline, ears, décolleté, hands, areas they don't always see themselves. We're not trying to diagnose anything. We are trying to train our eyes to recognize changes in the skin. The more you practice noticing what's normal for your client, the faster you'll recognize when something isn't. That awareness, that's what makes you a true professional.
I love that. Welcome back to the Skin Instructors. I'm Jolie.
And I'm Morgan.
And today's episode is one that every single esthetician needs to hear, understand, and honestly take seriously. We're talking about skin cancer awareness, what estheticians must know. So, May is Skin Cancer Awareness Month. And this isn't about stepping outside of your scope. It's about recognizing your responsibility inside of it. Whether you realize it or not, we're often the first line of defense as estheticians.
We really are. Yeah, and that's not meant to sound dramatic, but it's so true. We're seeing our clients more regularly than most healthcare providers. We're seeing their skin up close under a bright light, sometimes magnified, and we're touching areas that they don't check themselves. So if something changes, we might be the first to notice.
Exactly. And before we go any further, let's ground this in something important. Skin cancer is the most common form of cancer in the United States, and it starts in the epidermis, involving basal cells, squamous cells, and melanocytes. So, this isn't rare,
Mhm.
this isn't niche, this is something that you will most likely encounter in your career.
hmm And what's even more important to understand is how it develops. Most skin cancers result from cumulative UV exposure over time. It's not just one bad sunburn from a beach trip years ago. It's that frequent exposure, small amounts of damage adding up, creating mutations in the DNA of those skin cells until they start growing abnormally.
So let's break down the main types in a way that actually sticks because once you understand the patterns, it becomes much easier to recognize when something starts feeling off.
hmm
Basal cell carcinoma is the most common. And it is where many estheticians can miss it early because it doesn't always look aggressive. It can look subtle, a pearly bump, something slightly shiny, and maybe even a pink patch that the client says has just been there for a while. And that's usually the clue because it lingers.
hmm
It doesn't resolve as a breakout would, and it may even look like it slightly improves and then it comes right back.
And another thing with basal cell is location and history. So you'll often see it in areas that have had repeated sun exposure over time, like the face, especially around the nose, forehead, or cheeks. And while it's slower growing than other types, that doesn't make it harmless.
Mhm.
Left untreated, it can grow deeper into the skin and start affecting surrounding tissues, even nerves or bone in more advanced cases. So it's one of those things where early recognition makes a huge difference in the outcome.
Yep. Then we have squamous cell carcinoma, and this one tends to present a little more obviously, I would say, but it can be mistaken for something benign if you're not paying attention. So think about a rough, scaly patch that doesn't smooth out. Or something that a client says scabs, heals, and then comes right back in the same exact spot.
Yeah, that healing and opening pattern is a huge red flag. Skin should heal and stay healed.
Hmm.
When it doesn't, that's your cue to pay closer attention. And again, we're seeing this more commonly in sun exposed areas. The ears are a big one, especially the rim of the ear or the
Hmm.
neck, chest, arms, and back.
Yep. And then we have melanoma, and this one is the one that requires the most urgency in terms of recognition. This is the one that can develop from an existing mole or appear as something completely new. And what makes it so serious is its ability to spread. So once it moves beyond the skin, it can affect other parts of the body.
This is where the ABCDEs become such a valuable tool in your assessment. You're looking for asymmetry,
Hmm.
irregular or blurred borders, multiple or uneven colors, a diameter that's growing, and most importantly, evolution. And I want to slow this down a little because this is one of those things that gets mentioned all the time, but not always fully understood in practice.
Yeah. So starting with A, we have asymmetry.
Hmm.
And this means if you were to visibly split that mole or lesion in half, one side doesn't match the other. It's not balanced, it's not uniform. Most benign moles are pretty symmetrical. They're round or oval, and both sides look similar. So when something feels off balance or uneven, that's when I would start taking a second look.
And then B stands for border. So we're looking at the edges of the spots. So are they smooth, clearly defined, or do they look irregular, jagged, blurred, almost like they're fading into the surrounding skin? That blurred or uneven edge is what should catch your attention,
Hmm.
especially if it doesn't have a clean outline.
Yep. And then next we have C for color. This is a big one. So healthy moles are usually one consistent color. When you start seeing multiple shades, different browns, black, red, even hints of white or blue, that variation does matter.
Hmm.
It's not always dramatic. Sometimes it's subtle differences within the same lesion. So you really have to train your eye to notice those variations.
D stands for diameter, and traditionally we say anything larger than about 6 millimeters, which is around the size of a pencil eraser, is something to pay attention to. But this is where I want you to look a little more critically because not every concerning lesion starts out large. Some melanomas can be smaller, especially early on.
And then we have E, evolution, which honestly ties everything together. This is the most important one. Is it changing? Has it grown? Has the color shifted? Has the border become more irregular? Is the client saying it looks different than it used to? Even symptoms matter here. Is it itching, bleeding, crusting, or behaving differently than before?
This is where your consistency as a provider becomes so valuable. You're seeing your clients on a regular basis, so you're in a position to notice those changes over time.
And honestly, one of those best ways to catch that evolving piece is documentation.
Hmm.
We need to start treating photo documentation as a non negotiable part of every treatment.
Absolutely. I think taking photos at every visit isn't just for showing off before and afters.
Yeah.
It's really should be viewed as a clinical tool. When you have consistent photos in your client's chart, you can actually compare. You can look back and say, wait, that spot wasn't there, or oh, that mole looks darker. Even the border looks different.
Absolutely. And that's huge because
Hmm.
without that visual record, you're relying on memory.
Hmm.
And we all know that's not reliable
Right.
when you're seeing multiple clients a day. So it's going to help protect you and your client. If you've documented what you saw and when you saw it, that shows you're paying attention, you're being thorough, and you're acting within your scope. Also, photo documentation is going to be great for tracking your own treatments with your client. Is the treatment we're doing working? Those photos will help with that. So, because a mole or a lesion might not look alarming at first, but if it's changing over time, getting darker, expanding, and becoming uneven, that's when it becomes more significant.
And this is where we bring it back to your role because you're not diagnosing, but you are observing those patterns over time and you're seeing your clients every 4 to 6 weeks. And that's something that most medical providers don't have. You have a huge advantage of that consistency.
And that's powerful, not just for tracking treatment progress, like we said, but for recognizing that potential concerns early. It also helps you communicate more clearly with your client. Instead of saying, I think this looks different,
Mhm.
you can show them. That builds trust. It shows that you're paying attention and that you're thorough and that you're invested in their overall skin health, not just the service that you're performing on them that day.
And at the end of the day, that elevates you as a provider.
Yeah.
So let's talk about what you can say and what you cannot say when you're concerned that your client has an irregular mole or bump. You can't diagnose. You can't tell a client this is skin cancer. That's not our role. But what you can do is you can guide them.
Exactly. You can say, I'm noticing this area looks a little different than the surrounding skin, so I would just recommend having a dermatologist take a closer look.
Mhm.
Simple, calm, and professional.
You don't have to panic.
Mm-mm.
Don't jump to conclusions or assumptions. Just support them and direct them.
So let's talk about where we're seeing these things first, because this is where estheticians can really stand out. So the scalp along the hairline,
Mhm.
the tops and backs of the ears, the neck, the chest, and the back, and even the arms and hands.
Yeah, these are areas that a lot of clients either don't see well or don't consistently check, which is why your skin analysis after cleansing is such a critical moment. That's your opportunity to really observe without barriers like makeup or SPF in the way.
And when you combine all of that with consistent photo documentation, you're not just observing, you're tracking everything.
Now, let's touch on some high risk clients. Clients with a history of sun exposure, tanning bed use, fair skin types, they have an outdoor lifestyle, or a personal or family history of skin cancer. These clients need a little extra attention during your skin analysis.
And education's going to play a big role here too. Talking about daily SPF use, proper reapplication, antioxidants, and protective habits is key because most skin cancers are linked to cumulative UV exposure over time.
And again, this is within your scope. You're not diagnosing, you're educating and helping prevent.
Yeah. So let's talk about referrals because, again, this is where your confidence matters. You should already know who you're sending your
Mhm.
clients to. That was last week's homework. And have a dermatologist or medical provider that you trust.
And document everything. What you observed, where it was, and that you recommended a referral, because that's going to protect you and create a clear record of care.
Because ignoring something is where risk comes in. Observing, documenting, and referring, that's exactly what you're supposed to do.
Absolutely. And this all comes back to something bigger. Routine skin observation is an extra, it's just part of your role.
It's what separates a basic service from a professional, results driven, and safely focused experience.
All right, let's wrap this up with your homework for the week. I want you to refine your skin analysis process. So, after cleansing every client, slow down and intentionally assess their skin. Make it a habit to scan beyond just the primary concern areas.
And start incorporating that photo documentation at every single appointment.
Mhm.
Build that visual history in their chart so you can track not just treatment progress, but any changes in lesions, moles, or just overall skin appearance.
And if you don't already have a system for this, create one.
Mhm.
Keep it consistent, keep it organized, and actually use it as a tool, not just something you do occasionally.
If you want to continue building your confidence, your clinical eye, and your ability to truly show up as an advanced esthetician, make sure you check out our monthly membership called the Skin Instructors Extra Credit, and that is at www.sttraining.com.
Yeah, that's where we go deeper into topics just like this and help you build real world skills you can actually use in the treatment room.
And if you're loving this episode, don't forget to rate, review, subscribe, and follow us on Instagram at SD Training. It really helps us out.
And as always, don't hesitate to educate.